Hi everyone, I'm Cindy Pashang, nurse practitioner for Core Medical with Lumen Technologies. I wanted to talk to everybody this week about prolonging your healthcare screenings and actually taking care of yourself now that our pandemic is near the end. So let's talk about basics. Women, you need your pap smears done. It's probably been greater than a year, but no worries. You do have 3 years if you've had a normal pap smear. So that means it's time to call your healthcare provider or your PCP or your OBGYN and get these things scheduled. The other thing that I do want you to also remember is if you're over the age of 40, you need to have your mammogram also scheduled. So mammograms, we've all put them off due to we were all in lockdown for the pandemic, but now is the time. The faster we get you in to get your mammograms, the better off we are. According to some statistics out there, we're looking at over 10,000 people in additional deaths due to the delay in healthcare screenings. So let's talk about colon cancer. If you're over the age of 50, you do need colorectal healthcare. And that means you need to have a colonoscopy, or if you have had a normal colonoscopy or do not have any family history of colon cancer, then you can have what's done, which is Cologuard. Cologuard is an excellent way of screening. It needs to be done every 3 years, just so you're aware. However, colonoscopy is the gold standard of colorectal cancer screening. So men out there, you need to have a PSA done, which is easy. It's just blood work. It can be added to your physicals. And the other thing I wanted to talk to everybody about is if you have chronic health care needs such as diabetes, hypertension, coronary artery disease, you've had a stroke, you've had a heart attack, you haven't seen your cardiologist in a year, it is time to get back into the office. It's also time to go back and have your physicals done and maybe have your biometrics, check your lipids, and make sure that you don't have any heart disease, since heart disease still is the #1 leading cause of death in this country. So if you have any problems or questions, we encourage you to come ask your healthcare providers what screenings that you need and what screenings need to be finished up for this year. Take care.